cancer. Yeah.
Why has the cervical cancer rate gone up significantly since 2006? And that was the first year that we implemented the HPV vaccine.
I wasn't aware that it had gone up. If it has, I would expect it's because we're looking for it more intensively.
Yeah.
Seems like the answer I often get. I'm going to be completely honest. I'm anti-vaccine. I'm here to learn and ask some very specific questions. I appreciate that. Some specific questions I'd like to ask first is, are you aware of the Merck lawsuit, the fraud lawsuit happening in Pennsylvania?
I'm not.
Merck used animal blood to make their mumps vaccine appear as if it was more effective. So they're able to create a false positive of 98%. Right now there's a community of physicians, and I have the document right here in front of me. It's Chatham versus Merck, plaintiff, Chatham Primary Care Physicians on behalf of itself and others similarly situated. Defendant is Merck. So I have that. Why has the medical community not embraced going after them for their potential fraud?
Well, you catch me unawares. I'm not familiar with the lawsuit or the issues in the lawsuit.
What about the claims of William Thompson? Why has the medical community not asked for over 2 years now? We've had William Thompson come forward. I have all 10,000 documents. Why is it that we've not pursued a legitimate investigation into his claims? He's a senior scientist, whistleblower status. He said, I committed fraud. So
at the CDC?
Yes.
Right. That's been discussed very, very elaborately, and the general consensus in the community is that some of, I'm not an expert of this, but some of the views attributed to Dr. Thompson are not exactly his views, and the general sense is that there's
I have a written document. I have a written document that's with his signature.
I'm not in a position to debate the specifics because I'm not that familiar with the details.
Why does the medical community continue to use Paul Thorson's research to refute the claims that vaccines cause autism? Do you know who Paul Thorson is?
I don't.
Check the OIG Fugitive website. He's America's most wanted for committing fraud in relationship to the vaccines and autism research. He has several studies, such as the one done in California where it had a 14% increase in the vaccination rate, but huge increases in autism.
What's his background, just in brief?
So he was a hired researcher in Denmark, Paul Thorson. He was hired by the CDC to do the research to make the claims that vaccines don't cause autism. He's currently an OIG fugitive right now. If you look at the website, he's there. Why has the medical community continued to use his research to refute vaccines cause autism?
I don't know about his research in particular, but I'd be happy to put it aside. There's now a whole long list of studies. There are over 20 of them done by investigators around the world regarding the issue of autism and vaccines. I will tell you with complete assurance that question has been settled. There is no association between
the latest
time out.
Okay.
Fair is fair. Some other questions? And we'll hang out afterwards and we'll have some more discussion.
Are you concerned, though, that the latest research on this, not yet published, but will be presented to the American Association for Cancer Research, actually shows those vaccinated with HPV have a almost 40% increased rate of HPV high-risk infections?
Well, first,
that'll be
two things. First of all, I'm not aware of this. Second, I'm not entirely sure I understand what it is you've said, but hold the thought.
So higher infection rates for those who got vaccinated.
You know, restraint is a virtue.
And
also, good manners.
Well, I'd love for more people to understand the information that I'm talking about because I have the research studies in front of me, and it's very upsetting to me and no offense to you, I mean, I guess you're going to take offense, I'm sure, but the reality is, it's like, you're supposed to be the expert, but how come we don't know about Paul Thorson? You can't explain William Thompson, been over 2 years. I mean, that's probably the biggest question. And why you got Paul Thorson, you got William Thompson, you got Merck committing fraud like crazy. Why is it that the medical community isn't saying, you know what, enough's enough fraud. You want to know why people like me are anti-vaccine? I hate liars. My Christ does too.
Thank you.
We have the same